In my private practice, I work with a lot of psychiatrists, and I think that many people are misled about how important psychiatry is. First of all, it's really hard to get a psychiatrist right now. But if your partner has mental illness, unless you have a psychiatrist, it's going to be very difficult to move forward with them. And the great thing is that psychiatrists have a lot of skills that as a therapist I don't have. And that's why I need to work with them. And one of the main skills they have, and not only skills but knowledge, is they know the medications. And for many of my clients, medication is an integral part of restoring their mental health and helping restore their relationship. So I want to go through in this video the ways that mental illness affects relationships. And I'm a strong proponent that if your partner has a mental illness, you are involved in their treatment. In other words, it's one of those illnesses that you need to work together to create great teamwork. So first of all, let's just go through a few points about why mental illness is a struggle or difficult for many relationships. And the first of those is that I think if you find out in a new relationship that your partner has mental illness, you have a way to help them downplay it. Like you basically are trying to be close to them, and unknowingly you will inadvertently downplay the severity of it, because there is a stigma when you tell your friends, oh, well, they have mental illness. Many friends will kind of shy away, or they may not know how to respond. It takes really good friends to understand mental illness is like physical illness. You need to be treated, and you can restore yourself and your relationship, and you can be fully functioning. It's just that this part of your brain needs extra additional care. And secondly, depression, if your partner's depressed, it can take a real toll on what they leave you with as their partner, because you're going to have to pick up more of the slack. If you're with someone who has severe depression, then they oftentimes don't have the energy to do their chores and to do other things that make the relationship so vital. And I think this can potentially really damage a relationship unless couples are understanding and they're able to communicate it, and they treat the mental illness like a team. Just as you would a physical illness, you work at it together. And thirdly, many times with mental illness, intimacy is ruined. And it's ruined more so if couples don't talk about it. But let's say that your partner is very anxious because they know that sexually they're not the same person. They have a low libido, maybe some of the meds they're on, maybe they're on the wrong medications. It's taking away, it's deadening their libido. Then you, as their partner, is going to end up feeling sexually frustrated. You're going to want more. You're going to start projecting blame onto your partner unless you're working with them with a therapist, a psychiatrist, and you're actually getting the help you need to work on the different issues you need. And sometimes it's something as simple as a medication change. Or another issue is that many times when your partner has mental illness, you will become codependent. And when you become codependent, you actually enable their mental illness. You enable it to be worse. And you do that by not saying it out loud. This is a mental illness. You need to get help. I'm going to go with you. You are open about it with your friends. You educate others rather than keeping it to yourself or making what they're doing enabling it. Let's say they have compulsions and you keep buying more soap that they can throw away after they wash themselves one time. You're enabling the issue instead of being part of the treatment team, part of the plan to restore their mental health. So this is why I think starting out with a psychiatrist is a very good idea. And many times psychiatrists have been kind of downplayed because most of them don't do psychotherapy. But don't forget, just like Counselors know a lot of psychiatrists. A lot of psychiatrists work with counselors, such as myself. And the best is if you have both of us on your team, because then you're not only going to get the meds you need, but you're going to get the talk therapy you need. They help the partner understand mental illness. And I think that is so important that a psychiatrist does, because many times a counselor is not as trained about this as a psychiatrist. A psychiatrist knows the medical explanation, and you need that if you're going to help your partner manage mental illness. Secondly, some of them do talk therapy, and if they don't, as I already told you, they will refer you to a therapist. Psychiatrists understand the importance of talk therapy, and they don't dismiss it. They're not there just to be dispensers of medication. They're there to restore your full functioning mental health. They prescribe medications, and this is so valuable if you struggle with mental illness. There are so many new drugs, and they will usually titrate or calculate and have more than one medication at a time. They are actually looking, and they're scheduling all of your meds about how you should take them, when you should take them, and this is extremely important. So please, if no other reason, I would see a psychiatrist to understand my illness and to also learn my medications, know what they are, and be able to take them on a schedule that's going to enhance my mental well-being. They're good about changing meds. You may be on the same med you've been on. You may be on Buspar or Prozac, and you've been on it for years. And you go, it's always worked. Let me tell you, there's newer drugs, lower dosages that are going to work much better for your specific type of mental illness. And psychiatrists have this knowledge. You need this knowledge in order to manage and restore your mental health. And they're really good with connecting you, as I said, not only to a talk therapist, but to a couples therapist, because we all work in the same community, and that's mental health. And that's why and not only that, but psychiatrists want to know that therapist, because then that therapist can talk freely to them. Many times together, they're the ones that are best able to restore which medications you need. And I think that the mental health team you get is so important to restoring your mental health and your relationship health. Because remember, everything changes. You don't get into a relationship and then it's done. You've achieved your goal. The goal is to continue to love, to continue to be vibrant and joyful, and create an awesome relationship together. You can do that with mental illness, but you do need help. You need help from the mental team. And that means a psychiatrist, a really good talk therapist, and in many times, if you're going in as a couples therapist, it's worth the money. Believe me, it's the best investment you can make. Restoring mental health is the exact same as restoring your physical health. To live a life of quality, you need both.